it's a wonderful, wonderful privilege for me to introduce Glenn, Dr. Glenn Steele. He is in his 14th year as president and CEO of the Geisinger Health System in Danville, Pennsylvania. His list of professional and community-based organizations that he has affiliated with is very long. And I think more importantly, he has had a great influence on literally all of them. His achievements are many. I think one of the most important achievements, and I think we'll hear about this tonight, is the team that he has put together and has had to keep putting together at Geisinger. Because when you go to Geisinger as a leader, there's all sorts of other organizations across the country and probably the world that want you. And that, I think, is a highest tribute to a leader. And together, they have developed one of the most high-performing and innovative systems in the country, and some dare say, in the world. That Geisinger team has always been provocative as they follow a key trait of their leader, but always centered on the patient. I think they were the first to warranty their care with proven care. And they shined, I think, a very, very bright light on this issue of all of us profiting by the mistakes that we would make as opposed to taking accountability for them. They took the risks. Provocative, assertive, and always spot on. It is my pleasure to present the Gail L. Warden Leadership Award to Glenn Steele. Glenn?
Yeah, thank you very much, Jeff. I actually had a second script. As most of my friends and colleagues know, I have a real personal antipathy to lists. You know, list of the 100 most powerful, list of the 10 most admired, and I certainly have an antipathy to the list of the 10 best dressed hospital leaders. I also tend to shy away from almost all self-serving awards and any hint of personal deification. But tonight's different. I can think of no better role model than Gail Warden to aspire to. His name on this award is meaningful to all of us and who are committed to better health care. And I can also think of no better cohort than the Henry Ford Health System and Nancy Schlichting for Geisinger to be associated with in this year's celebration. I'm honored and humbled and in particular pleased both individually and institutionally to be linked with Gail, Henry Ford Health System, and Nancy. My journey at Geisinger over the last almost 15 years would not have started without an amazing leap of faith by my wife and my family. The first move from Boston to Chicago, which was the second phase of my leadership career, was an early sign of farsightedness or intellectual and emotional instability. The subsequent move from Chicago to central Pennsylvania was early on thought to be near psychotic. And only over a period of time was reinterpreted as being visionary. But my wife and youngest daughter bought into it up front, and so it happened. And I want to acknowledge Lisa and Laura, who are here tonight. This whole 15-year journey would not have happened without them. Obviously, an organization is only as good as its owners, and a sure sign to me that governance at Geisinger was superb was the evidence of its great risk-taking. This was the attempted Geisinger merger with Hershey Penn State. And just prior to my recruitment, the follow-on to this great audacity, which of course was the wisdom of demerger after 3.5 years of dysfunctional marriage. This was the baseline for my entrance to the Geisinger scene. The continued efficient, wise, and fully committed governance, which now includes local, regional, and national membership, has been at the core the reason for Geisinger's remarkable transformative innovation leadership. And I'd like to acknowledge several of our trustees here tonight. Thank you for being here. Heather, thank you for being here, Virginia. And as well, the senior colleagues that I inherited and recruited, the physician, nurse, and administrative leaders that bought into our transformation journey, a family of extraordinarily accomplished human beings who oftentimes had been loyal to Geisinger over multiple generations, were really the critical engine for what I've been privileged to experience over the last decade and a half. And I'd like to acknowledge a huge number of my colleagues who are here tonight, and I did not insist that they come. There was no mandate that they come. Actually, all I needed to do on arrival was to raise the aspirations and to create a narrative that would convince our Geisinger associates that we actually had the perfect fiduciary structure, the perfect service area and demographic stability, the perfect market share on both the payer and the provider side, and the human and financial capital that would allow us to fundamentally change healthcare delivery and payment for care that other superb medical delivery and medical insurance institutions could never hope to accomplish. So after almost 20 years in several leadership roles at great university-associated medical schools, I'd become convinced that what limited health status improvement was not new knowledge generation, but the application of new knowledge in an efficient way to change how healthcare was provided. I saw Geisinger as a perfect venue for fundamentally changing caregiving and payment for caregiving for both hospital-based as well as ambulatory chronic disease management outside of the hospital. I also saw the early model of vertical integration, similar to the Ford system, between payer and provider as a possible bridge to both payer and provider working together to create improvement for both individual patients as well as for cohorts of patients, who almost all represented two linked problems: poor outcome and high cost. My ability to convince our physician leaders that re-engineering care delivery was focused not primarily on cost reduction, but on improved patient outcome was the key touchstone to unleashing professional pride of purpose. And as opposed to what most non-caregivers believe, changing payment incentives is secondary in driving value re-engineering success. Unleashing professional pride of purpose among those who are delivering the care touches the core of why most of us originally went into healthcare. A second critical precondition for the Geisinger value re-engineering journey began in 1995 when the system became totally electronic in partnership with Judy's company, Epic. And the power of near real-time data flowing between the two parts of our organization, payer and provider, enabling point-of-service efficiencies, plus the unleashing of professional pride of purpose were the keys to Geisinger's proven care, acute, the warranty, the chronic disease, bundled commitment, best practice, and our version of medical home, which is called Proven Health Navigator. Only after our payer and provider leadership decides on what care should be redesigned and how the redesign should be enabled with data flow, what enabling techniques needed to be put in place, only then are payment incentives realigned. So biologists would basically say the payment incentive realignment is constitutive, not causal. That's a throwback to my time at University of Chicago. I'm sorry. It's important to note that my leadership career at Geisinger is one small part of almost a 100-year history of remarkable institutional innovation. When Abigail Geisinger founded us a century ago, she decided to model her hospital after the Mayo. Her recruitment of the first chief, or more correctly stated, her kidnapping of Harold Foss, who was on his way to private practice in Philadelphia after a fellowship with Will Mayo, her insistence on an employed physician group, this is in 1915, the early opening of her hospital in Danville in response to a public health crisis, her daily concern, remember, this is in 1915, her daily concern, which is documented, over the expenses that patients at her hospital had to pay, were precursors to where we are today. The stability of our doctor-led group, only 5 CEOs over 100 years, the evolution of Abigail's hospital into one of the nation's first regional health systems, the core hub-and-spoke healthcare delivery design in a rural environment, the initiation of a provider-owned insurance company, the expansion of community practices into 42 of Pennsylvania's counties, the transition from discipline-based to interdisciplinary service line care, the decision 20 years ago to create a complete outpatient and subsequently inpatient electronic infrastructure, the establishment in the 1980s of clear-cut self-replicating governance for the entire entity have all provided the context into which my span of leadership has been grounded. So our present innovations are simply add-ons, if you will, to the baseline we inherited. Changing the adversarial relationship, even at Geisinger 15 years ago, between payer and provider into a functional payer-provider sweet spot, focusing together on higher quality at lower cost for those we serve, initiating our fundamental value reengineering of hospital-based care, so-called warranty, and the reevaluation of our caregiving for ambulatory disease, our so-called proven health navigator, our movement of care from where the doctors are to where our patients live, activating our patients and insurance members to become the owners and co-managers of their health, and our commitment to enable and incent continuous system-wide innovation, accepting that some of that innovation won't work, are all straight-line extensions from what Abigail founded us to do 100 years ago. Obviously, the challenge and the excitement are not over. The question now is how much of what we've done in Shangri-La can be scaled and generalized elsewhere. And those experiments are underway. Our insurance companies are working in multiple states with non-Geisinger, non-employed providers to see if the payer-provider sweet spot can be replicated. The present frantic merger and acquisition activity has led our own system into new markets, Scranton, Wilkes-Barre, Harrisburg, New Jersey. We'll soon see if the innovation magic can be expanded and sustained despite this increasing size and complexity. And our joint venture spinoff, XG Health Solutions, is attempting to take our key transaction, intellectual property, and underlying enabling technologies into other national and international markets using someone else's money. Finally, let me acknowledge and congratulate the National Center for Healthcare Leadership. Your organization's mission is worthy, and your accomplishments are of great import. Of course, any true leader should spawn acolytes, and any great institution should spawn new leadership. I'm proud that we have Geisinger leadership alums in the audience tonight, and particularly proud that during my tenure at Geisinger, we have seen 7 colleagues become CEOs and 3 colleagues become CMOs of other healthcare organizations. I do sometimes wonder, however, if this is too much of a good thing. So once again, I'm honored and humbled to be linked with the Gail Warden career, name, and credibility, and to share the honor with Nancy. And I look forward to immense progress in access, quality, and value in caregiving, and for some of us in care-getting, over the next few generations of our leadership progeny. So thank you very much for the award.